Oh, they're literally perfect. Perfect, thank you. Thank you so much.
Hi, my name is Khadija. I'm an oral surgery nurse and implant nurse. Welcome back to another day in the life of YDS. Today we've got lots of exciting cases going on. I'm with Dr. Nigel today and we're doing a few implant cases today. We've got some bridge work to fit, so stay tuned.
At the moment what we're doing is we've ordered some phenomenal furniture. We've added a 6th surgery to the practice to ensure that our patients receive the YDS VIP service from us. Due to the demand of patients, the increase, we've added the new surgery which will be ready next week. Really exciting news. It's going to be modern contemporary design inside to ensure that patients feel the VIP treatment from YDS.
I'm going to do some follow-up for the aligners, the new Smile White aligners. So I'll be calling some patients that have not maybe rebooked in for consultations, give them a call, follow up why they didn't rebook with us, and then try to sell them our Smile White aligners.
But that's the reason, because environment is the most important thing. So when you put yourself in an environment of success, then you're more likely to become successful. So having inspirational quotes around you, books, things that are going to motivate you will really help you in your life and where you want to go. So my advice to anybody out there that wants to reach success: analyze your environment, where you're working, where you're spending time, and what can you do to make that environment uplifting so you can get to those heights. The best vlogs in the dental industry, you'll find them here, guys, so make sure you tune in, make sure you subscribe, much more content coming. Yeah, so for those of you that are new to the channel, this is our practice. Alex, come and join, our right hand man. Hello. HR and operations manager does a fantastic job every single day. And
what about me?
This guy was sitting with his tight shirt. But what Dr. Paul doesn't know is we're going to be hitting the gym hard again, and he's going to have to.
He's getting worried.
Level up.
He's getting bigger.
With his muscle side. When's the rap coming? Because this guy raps as well, by the way, guys.
Yeah.
Don't strip on camera.
Too much sugar.
Yeah, no, we did a good video today. Yeah. Pretty creative, so I'm excited to get one out.
No, Mike, how is Yorkshire Dental Suite different to other clinics that you worked at?
Yorkshire Dental Suite's different energy, always thinking ahead, innovative, creative, stepping outside of that box of dentistry and taking things to the next level in every sense.
That just sums up perfectly. So at Yorkshire Dental Suite, we don't just do dentistry, we bring the whole element of patient care, energy, being creative, pushing forward, trying to innovate. Yeah, I mean, it's all down to fantastic team members like Dr. Phil, like Alex, who really build into that vision and understand it all and want to push forward.
Exciting.
Boom.
Boom.
Love it, guys.
Boom.
Look, this is the lovely Khadija. Khadija is obviously fasting today, and she's walking around like a puppy. How's Ramadan been?
Been good.
Yeah. So for those of you that are following, Ramadan is basically where we fast from sunrise to sunset, and basically Khadija's been walking around like a zombie for the last month. So I think she's looking forward to being able to eat again, aren't you? Those sweets at lunchtime. Yeah. So basically, for those of you that are new to the channel, we're based in Leeds. We're a fully private dental practice. Right now we're on the top floor. So when we first started 4.5 years ago, we started off with 2 surgeries downstairs, and now 5 years later, or 4.5 years later, we're now upstairs. We've got 6 surgeries. We're just about to add this new surgery on. Come and see this. To really be able to expand our services and treat more people. So that chair is being installed this week. We've got some cabinets coming in, a painter and decorator. We've got all the furniture that's arrived as well, a lovely stylish chair, a nice table, a few different things to spice her up a little bit. So it's really fantastic to see how much we've grown over the last few years. I'm going to leave you guys with Zayn. I'm going to take this phone call, check back in with you guys soon.
There's something different about you. I don't know what it is. I can't really put my...
Is it the grandfather collar?
I don't know, maybe it's a shirt. I like the moustache.
Do we like it? Is it here to stay is the question. I mean, I'm all one for change. Whether change is an improvement or maybe not, I'm all about feedback. It was only yesterday at 5 I cut my beard down and you can already see it coming through. If I miss a beard, all I gotta wait is a week and it'll make a comeback. So that's my thinking of making bold moves like this. It will always go back. So we've got a patient in the morning, Rachel. We're going to be bonding the top 40. So it's quite common that we do that just to even out the edges, because the smile actually sits mostly in the 4th just to get the edges evened out, the smile actually perfected within the constraints of the natural smile. Anyone that actually wants to get more teeth obviously will then create an even better smile if they want to kind of make things more better than how they actually feel. So it's then you add it to the canines to brighten the canines, because usually the canines are the darkest teeth in the mouth, and to widen the smile a bit, or to even drop the point of the canines to make them kind of flatten in a way. But it's interesting because people come in and say actually want their canines to be flattened and actually want them to be contoured and drop down, but in doing that it makes them look really unusual. So there's a way of actually bonding the front of them so you don't really touch the canine. So if you imagine the canine is like this and then your other front teeth are like that, I guess. And then what you do is just bond the front of it, and by bonding the front of it, it connects to the front teeth, and in that way you actually create a smile which is more even, so it gives the illusion of the canines being flatter without actually having to remove the point or remove very, very little. So that's basically why I love bonding. But for you, what do you think? Like, what's your experience of bonding?
For me, when it's the end of the treatment, we give the mirror to the patient, and we can see in the patient face is very happy. He's not like just a fake smile, you know, like yeah, I'm happy. You can see the
So Amaka is amazing. You know, she's got such a great energy. We've got a great team spirit here at YDS. And you know, speaking for all the nurses here, really, you know, there's such a high standards that all the nurses set for themselves, and I think that's the most important thing, because as dentists, you know, patients come to us wanting this perfect smile, the best that they can achieve in their smile, and what we expect then from our nursing team is to provide that extra level of service where it's not just about performing a duty, it's about being the best who you are. And I think that's the special thing about YDS, the philosophy that it has, and that's why, you know, I love working here, doing bonding, creating beautiful smiles, working with beautiful people, and creating those beautiful results.
Got any patients coming
Mixture
in?
of things, a couple of implant surgeries, a few things to fit, crowns, partial dentures. Nice mixed bag, really. A bigger implant case this afternoon for a guy who's having all his upper front teeth removed. He's having implants placed immediately, and he's going to have a fixed temporary bridge put straight in rather than having to have a denture. So in patients like that, it means they've not got to go through a denture stage. It helps to sculpt and form the gum. So it's a really nice, convenient way of being able to deliver permanent upper front teeth right from the day of surgery.
So what got you into implantology and like dentistry overall?
Dentistry, I could have nearly been a builder. I was going to go into business with my dad. I didn't quite get my A-level grades first time, so I had to resit some A-levels, and I made a pact with my dad that we're going to open a builder's yard. Should I not have got the grades, but so I ended up being a dentist. Why implantology, specialisation? Interest, really. I did NHS general practice for about 8 years. We then did a private practice conversion. I wanted to improve skills, deliver cosmetic dentistry, so we took our NHS practice out of the health service into private sector, and it was at that time that I started training. I'd never done any training in implants at that stage, so towards the end of the 90s, 98, 99, I started doing some implant training and sort of got bitten by the bug. So I sort of sold my general practice at that time. Went to a specialist centre in Manchester, did my master's degree, did the implant training. We were over there for about 5 years before moving back home to West Yorkshire, and was in Halifax. I had my own referral practice in Halifax for about 16 years, and only recently finished working in Halifax to be full-time here at YDS.
Nice.
So,
And what do you love most about YDS, and how would you compare that to other dentists?
love YDS, problems with staff sometimes.
He loved it because of me.
No, it's great. It's a fabulous team. The team support each other. It's for the right end. It's to consider the patient, deliver the best we can for the patients, and whether it be front of house, whether it be nursing, whether it be clinical staff, we all pull together to achieve that, which has been quite rare in practices that I've worked in the past. So yeah, I would say the team effort is the biggest thing at YDS.
Hello, Dr. Raja.
Hello.
Don't let him bat you down on price.
How are you?
Good.
This is how good these loops are. Wait, then I thought it was Dr. Rajan. This is how good they are. Apologies to all my patients who had surgery by me before the loops.
These are called dental loops, so dentists use these to be able to see better during the treatments because they actually magnify into the area. So if you imagine a magnifying glass, these are literally magnifying glasses on glasses. So it basically improves the quality of the treatment in a lot of cases, and it just makes the treatment even more precise. So Dr. Lagos is just choosing his style now. I actually got my lubes, the first time I got measured up was when I was in Spain, in Valencia, and it was a Spanish rep of the same company, but it was nice and sunny in a nice table in the cafeteria in Spain. So a different experience, but...
Well, here, it depends on what I'm doing, I can move the lenses. If I'm doing extraction...
It might give you some superpowers.
Yes, so if I'm doing extraction, just take it off. I don't need loops. If I'm doing implant, I'll have to choose the...
No, with all 4 of them.
Strongest one.
You look like a super villain.
Hi guys, so we've got the gorgeous Rachel in next, and we're going to be bonding the top 4 teeth to give this amazing smile makeover for her. And so I'm going to go through kind of what we're going to be doing with her when she comes in just a moment. But it's in for about an hour and a half, super simple, but it's going to give all the most amazing results for her. She just literally came in for a consultation, was not happy with the edges, the colour, the shapes of her front 4 teeth. And so we don't need to do any Invisalign, just straight in for the whitenings, which is done now for the last month to 2 months now. And so today's the big day, we're going to get that smile makeover for her, so can't wait to share the results with you. In terms of what the plan is, we've got these 2 side teeth and the front 2.
Yeah.
What are your thoughts on the front 2? Do you want to kind of match the colour of where they are to the rest of the teeth, or do you want to go a bit brighter?
Probably just match them. I feel like I'd be happy enough to keep it kind of natural.
Yeah.
And these 2, I mean, this one, I find it so hard to get the whitening up on this.
Okay.
So obviously when that's bonded, I don't know, can you make this a bit like this one?
Yeah. Yeah. Was that always what you thought?
Yeah, I think it was. Yeah,
Fine.
it's these 2, and then whether to add these on. But I think I'm happy enough.
Happy to leave.
Yeah,
I
these
think
are
I'm
big
fine.
anyway. So
Yeah.
it's trying to, because these are so large, it just makes these look really
Perfect.
small. Oh my god. They don't look like my teeth.
They're your teeth now.
Oh my god. I love them so much. Oh. Thank you so much.
You're welcome.
Thank you. Oh, they're so nice. Thank you so much.
Just like your teeth now. Just keep it in.
Oh, thank you so much. I literally love them. Oh, I didn't think
Take it in,
Oh, they literally don't look like my teeth.